Okay, we are going to start our session. Welcome everybody to IMCAS Asia 2026. Good evening, my dear college. I'm Dr. Atinudongkao from Thailand, and today I will serve you as the chair and moderator for session with ASTERASYS for the topic of evidence-based synergy for next generation tightening and lifting. Today, we will have two esteemed speakers who will not only share about the lecture, scientific lecture, but also with the live demonstration with the protocol called Kultura, which I think is very good because it can have our practice to be more better for our patient because we can have the fast, effective, long-lasting with minimal downtimes. And for the scientific lecture, I cannot think of anyone else than my lovely sister here, Dr. Charuta Unchitichai. She is a medical doctor from DDR Clinic. She received a doctor of medicine program from Pramongkut Ghao College of Medicine with first class honor and completed the Thai Board of Pediatric. And further, she pursued advanced training in dermatology and anti-aging medicine. She also is an experienced trainer for multiple aesthetic programs. And today, Dr. Charuta will share her lecture on Kultura Clinical Mastery Evidence-Based Tightening for Contouring in Aesthetic Practice. Please join me in welcoming Dr. Charuta Unchitichai. The stage is yours.
Thank you, Dr. Artinus, for the presentation for me. So, good evening, everyone. It's my pleasure for me to be here talking about the Kultura. Today, I will talking about the clinical mastery, the evidence-based tightening and contouring in aesthetic practice. It is important to understand that the facial aging is a multifactorial and a multi-layer process. It involves a complex interaction between the skin, subcutaneous fat, retaining ligament, muscle, mass, and underlying bony frameworks. When we're looking at the anatomical illustration on the right, we can see that how facial support depends on the network of the retaining ligament, fibroceptal connection, and the fascial layer. Therefore, successful rejuvenation requires a comprehensive approach. So, as you see that the aging skin is driven by both intrinsic and extrinsic factors. At the cellular level, the aging skin, the key hallmarks is the reduction of the collagen 17A1 that played an essential role in maintaining the epidermal stem cell integrity and the epidermal stability. And another important that biological chain is the accumulation of the oxidative stress and the dysregulation of TGF-beta signaling. So the main consequence of the skin aging are the reduction of the collagen, elastin production, chronic inflammation, and progressive the ECM degradation and barrier dysfunction. So knowing this biological skin aging that's why we can fix it at the right place. And one of the most common concerns that we encounter is the nasolabial fold, which is a consequence of the age-related change occurring in the mid-face supportive system. The mid-face supported by the complex and interaction of the soft tissue compartment and the mass layer. With the aging, these support structure gradually weaken. So the key message here is that the nasolabial fold formation is the multifactorial shown as the diagram. The malar fat pad deflation, weakening of the retaining ligament, deep fat compartment change, anterior displacement of the soft tissue. So the nasolabial fold is offered as a symptom of the mid-face aging rather than the isolated defect. This is why the direct collection of the fold often produces the limited improvement, and the main treatment should be at the mid-cheek improvement, which is the concept is particularly relevant when using the energy-based device. And Over the past few years, the GLP-1 receptor agonist has transformed the management of the obesity and metabolic disease. However, as the aesthetic physician, we are we increasingly encounter a new group of the patients presenting with the facial change associated with the rapid and substantial weight loss. As you can see in the picture, that there will be a hollow of the temple, tired eye, sunken cheek, thinning the skin, and jawing. This clinical feature of that so-called that Ozempic phase is caused by the inhibition of adipocytes maturation, decrease in estrogen resulting in the thinning of the skin, looking at the grinding appearance, deepening of the wrinkle, and loss of the facial volumes at the cheek and the lips. Also loss of the collagen following the massive weight loss and reduction of the essential fatty acid due to decrease the nutrient. So when we know the cause, we need to treat it. The treatment approach for this Ozempic phase or GLP-1 RA receptor phase, we have to comprehensive multimodal approach. It is essential and effectively not managed. For me, at first, the key principle is we need to improve the skin quality and skin stimulation the collagen first. When the supportive skin is strength enough, then we can fill up and or restore the loss of the volume, maybe by the filler injection or maybe by the fat transfer. Or if there are some cases with a very significant laxity and cannot curing with anything else, we can tell them to go like surgery. So however, a personalized patient-centered approach is the key to achieving the natural and long-lasting rejuvenation. So what is Kuvera? Kuvera is the synergistic platform combining the monopolar IF and the HIFU technology to deliver the precise, effective, and the safe skin tightening. Why we have to combine the RF and the HIFU? As you can see in the diagram, for ultrasound, we can do the heat specifically at the precise depth that we select at the SMAS with the temperature around 60 to 70 degrees Celsius can cause the neocollagenesis at the deep. However, for the monopolar F, we can cause like a volumetric heating or bulk heating at the superficial dermis. This can cause the new neocollagenesis. And when combining both HIFU and monopolar RF can cause the better outcome. So we're looking at first at the cool phase. It's the most advanced monopolar RF device with the direct cooling contact tip, as I see it in the video. Here is the direct contact cooling system that can penetrate the heat more deeper. So we can go and focus on the deep dermis and fibrous septa and produce the new neocollagenesis inside. So before we going through that, we have to know the main factor that influence the interaction of the RF and the tissue. The first one is the monopolar RF can possibly reaching the deeper tissue than the bipolar RF. The frequency of 6.78 MHz is the optimal frequency that can cause the deep dermis to get more penetration of the heat and produce the collagen. The larger tip size can create a greater energy dispersion and the RF penetration than the smaller tip. And the greater cooling system can get the deeper depth of the thermal effect. How about the conductivity and the impedance? The impedance is like determine the resistance to the passage of the alternating electric current. And conductivity is vice versa. What we need is we need the tissue to get high conductivity and low impedance. That's why we can create more neocollagenesis. And the factor that influence the conductivity is the potency and the pulse duration. Higher potency and pulse duration can accumulate more energy. The skin hydration and high temperature can increase the conductivity and the tissue characteristic. As you can see that the epidermis has the high impedance and very low conductivity. What we need to focus, we will focus at the dermis and the fibrous septa at the area of the subcutaneous tissue. That's why we can get more skin tightening. How about the ligament? At the research that they found out that the histological evidence show after the monopolar RF procedure, they found the collagen remodeling and thickening after the treatment for the retaining ligament. Here I concluded for the mechanism of the action. The heat generation at the 6.78 MHz between tip and the grafting pad, letting the elastic regeneration by the volumetric heating of the monopolar IF and stimulate the collagen and tissue tightening finally. As also you can see the energy spreadsheet. Although the physicians often focus on the treatment level, what actually determines the tissue response is the total energy delivered into the tissue. And the relationship is very simple. Energy is the power multiplied with time. This means that the biological effect is not determined solely by the power setting. Both power and treatment duration contribute the final thermal dose delivered to the tissue. So cool phase offers the broad range of the treatment level, allowing the physician to tailor the treatment. And this is the DCC technology with the micro refrigerator system. You don't need a cooling gas tank. You don't need to worry about anything like vacuum seal or vacuum function. In here, we have the power temperature maintenance system, direct cooling method, accurate temperature detection, precise impedance measurements, and reliable delivery of the energy with the high power RF. So the common application will focus for the skin tightening, wrinkle reduction, body contouring, and texture improvement. Here is the research that I found out that they use the cool phase, treated the ligament focus advancing the monopolar F radio frequency from Brazil. They doing at the adult aging more than 35 years old, mid to moderate laxity, and they using 1,000 shots per session at the area of the total face, neck, and neck region. Targeting at the ligament and fibrous septa with the hashtag pattern, the energy level will be around 8 to 10, but it depends on the patient's sensation. They find out that the significant improvement in the skin thickness, texture, elasticity, facial and neck contouring, and wrinkle reduction with no or minimal pain with highly patient satisfaction. So this will be the protocol that I will talking today, that at first I will focus to do the cool phase at around the retaining ligament of our face, starting from the temporal area, orbicularis retaining ligament, zygomatico-cutaneous ligament, zygomaticaus ligament, mesenteric ligament, and mandibular ligament, around 100 shots and per side. And then the total face will be 200 shots with the hashtag pattern overlapping around 30 to 50%. And if you want to focus more about the submental or neck, you add on 100 shots per side, and then you can waiting for the result. Here is the protocol. The main thing that you need to know that the level may vary depending on the patients. Adjust the level based on their sensitivity to heat, always closely monitoring the skin reaction and the patient response. And avoiding the treatment at the thyroid area, the number of the shot may vary depending on the patient's facial area. So and also focus at the vector that we want to tightening or lifting and the ligament. So the next device will be the Liftera 2. I call it like high intensity focused ultrasound, the LIFTERA 2. As you know the mechanism of HIFU. The HIFU can cause the mechanical effect of the ultrasound going to the cavitation in the tissue and cause the heat generation around more than 60 degrees Celsius and causing the coagulation necrosis and doing for the neocollagenesis. This is when we focus at the specific depth, especially at the SMAS, the post-reaction will be the SMAS target layer contract immediately and can cause the skin lifting and tightening. With the technology of the thermal diffusion technology can cause the thermal energy to spread more uniformly within the target tissue. Okay. And also, the LIFTERA 2 have both dual type of the cartridge, the light cartridge and the pen cartridge. The pen cartridge can have the minimal contact surface for easier treatment to the curved area of the face, such as an area of like nasolabial fold, marionette line, or maybe submental area that the light cartridge cannot go through. So we can use pen cartridge to getting more detailed. And we also can adapt to focus when we're trying to focus at some area to getting more lifting and tightening. We do move our hands slowly for the aggressive treatment. For my treatment, we can move our hand faster. So here is the bidirectional continuous dot technology, as you can see. This continuous dot has the homogeneous result and precise and fast. It improves the treatment speed, uniform homogeneous dot, and get more predictable clinical outcome and accurate the energy placement. And actually, when we don't know that how depth is the SMAS for each patient. Of course, if in your clinic have the ultrasound, you can use the ultrasound to estimate the depth of the SMAT at each area. But if you don't have, here is the trick. The personalized tip selection based on the skin fold thickness to the target, the optimal tissue plane is safe and effectively. For like a 50% rule for the tip selection, if the skin fold thickness is more than 3 millimeters, you can target the depth around 1.5, such as the area of like the forehead or under the eye. If the skin fold is more than 9 millimeters, you can choose the target depth around 4.5 millimeters. Okay. Here is the LIFTERA protocol. For me, I still use this because we have to decide which patient has like a narrow face. If too narrow face, you can also use the HIFU or LIFTERA too. But you decide to use like the cartridge will be 3 millimeters and 1.5 millimeters with the level that you can estimate the pain and the sensation of the patients. For the normal face and the larger face, you have, for me, I will choose like every type of the cartridge. 4.5 located at the area of the thick skin fold and going through 3 mil at the mid face and then 1.5 to correct all like the pore size, wrinkle, and forehead area. Okay, here is the summary of the different mechanism, but we're going to the same endpoint. It means the neocollagenesis. So the next question is whether should we use monopolar RF first or HIFU first. So this study showed that in the 24 current adult split phase study, this one side they use monopolar RF first and then the other side they use the HIFU first. They found out that at the side of the monopolar RF followed by the HIFU, showing the trend toward the superior wrinkle improvement. But however, the histological finding or safety profile in both sides is equally no significant difference. So when you choose, for me, I will choose that for patients with Kutera, I will choose for patients with mild to moderate skin laxity. You want to correct the fine line or the wrinkle, collagen remodeling, and post-weight loss skin laxity. When the patient needs to correct the skin quality, I will choose the RF or the cool face before Liftera 2. When I want to correct the lifting and contouring of the face, I will choose Liftera 2 first and then following with the cool face. So this we can tailor the treatment. So here is the clinical case shortly before the live demonstration. Here is me, myself. I'm doing the history of the GLP-1 treatment. Before that, I'm have the shabby chic, okay? And then I'm most of Thai patients trying to lose their weight first before doing other procedure. And after losing the weight around 6 kilogram, then you can see the node facial volume of loss and laxity. Hollow the temporal area, hollow shake, increase the nasolabial fold, and also the marinate light. The thing that I chose that I will choose to correct the skin quality and produce the collagen stimulation first. And then I just collect the volumes. After that, at May, I choose to do, back then we have, Thailand we have only Liftera A, and right now we do have Coolthera, Liftera 2 and Cool Face. I did the Coolthera program. The protocol is I use the Liftera 2 first. Mainly when I use the 4.5 depth, my level will be around 10 to 11. And for 3 millimeters, I use the level 7. That's mean the maximum of it, okay? And then I'm design at my face the treatment shot, as I told you, this one. And I will collect the last one with 1.5 mil depth to collect the superficial tightening and texture improvement. And then I'm going to do the cool face later. Mainly, yes, as the protocol, I did the truly training ligament first for superior lifting, okay? And then I do the whole face. Totally, I use the 800 shot as with the hashtag pattern. And here is before and after. I have to tell that after the treatment, you can see my erythema and my edema, so you may not see the result effectively. Maybe around 20% of the lifting and tightening effect. And after that, the optimal result, you will visible significant improvement around 1.5 months. Okay, that's why I will always tell my patients like that. And here another case that I want to show that 45 years old woman with post-weight loss too. She lost 5 kilometers. She do not want to inject anything in her face. She want to do only just energy-based device. When I examined her, I found that she has a very a moderate skin laxity, facial sagging. She just want to look herself to get more confident and more better. And here is the result. I used the Liftera 2 first and continuing with the cool face with the ligament focus advanced protocol. And here is, she sent me back 45 days later because she lived in the Phuket. She cannot follow up here. And as you can see that before, you can see the increase the nasolabial fold. She looking grumping, look old. And after 45 days of the treatment, you can see that she look younger, look more harmonized, look more natural looking, decrease the nasolabial fold and marinate line, and defining her jawline is better. And one last case, there was a male 35 years old concerning about the mid-cheek groove, moderate stacking of the mid-cheek and jawing. He didn't want to inject anything too. So here I did the Cool Thera program. I used the Liftera 2 before the Cool Face again. And then as you can see, 30 days after this, you can see the defined jawline of the man is better, mid-cheek lifting, decrease in the nasolabial fold, and he's happy. So finally, preserving the facial harmony requires thoughtful planning, and volumization alone is not enough. So we need to well-support skin is the foundation of the natural skin rejuvenation. And their successful weight management should preserve not only health, but also facial balance and the confidence. Thank you for your attention.
Thank you so much, Dr. Sarita, for your fruitful and informative lecture. If you guys have any question, maybe you can send it for in Q&A live, or maybe we can discuss after the live demonstration. So next, after the lecture, we move to live demonstration with Dr. Chatrin or Dr. True. He will perform a live demonstration for us today. Dr. Chatrin is a medical doctor from Angelic Clinic with strong expertise in injectable treatments, facial rejuvenation, and thread lifting. He graduated from College of Medicine and Public Health, Ubon Ratchathani University with second grade honor. He has pursued extensive advanced training in aesthetic medicine, including filler injection, facial rejuvenation, thread lifting, blepharoplasty, and cardio-based anatomy workshop, both in Thailand and Korea. His clinical background reflects a strong focus on combining anatomical precision with practical aesthetic outcome. Please join me in welcome Dr. Chatrin. The stage is yours. We have 25 minutes, okay? I will remind you when the time is up, okay? Your turn, Dr. Chatrin.
Okay. Okay, thank you. Okay, let's get started. Okay, good afternoon, everyone. I'm Dr. Chatrin from Angelic Clinic in Thailand. Today, I'm going to demonstrate the Kutala lifting procedure for facial tightening and contour improvement. First, I would like to assess the patient facial structure and skin laxity. The main concern is lower face and jawline laxity with around facial contour. Okay. We also want to improve the facial contour and skin firmness. Okay. Second, I will begin facial mapping. I will draw the functional ligament line from the temporal septum through lateral orbital thickening, zygomatic ligament, and mesosteroid ligament. I mark zygomatic arch and the orbital area. I will mark important danger zone, especially marginal mandibular and temporal branch of facial nerve. Okay. For this patient with oral face, I usually start with Liftera 2 first. This may help lower tissue impedance. My goal is to create deeper lifting effect first, followed by cool face to enhance skin tightening and tissue remodeling. Before we start, let me briefly summarize treatment plan. I will use the 4.5mm transducer on lateral face and submandibular area. Okay. To target smash layer and create deeper lifting effect first. Second, I treat when using the 3mm transducer on lateral face, anterior malar area, and temporal area to target deep dermis and subcutaneous fat, and additional focus lifting and contouring. Okay. Finally, I use cool face to target dermis and fiber septae along lifting vectors, including the functional ligament line, the nasolabial fat toward lateral orbital area, and the jaw toward pre-auricular area. Okay. Now, let's get started. As mentioned, I will be using the 4.5 millimeter transducer. On lateral face to target smash layer. I will use 70 shots per side. Okay. Okay. I use non-dominant hand to gently lift and stabilize skin during treatment. Does it hurt? เจ็บไหมครับไม่เจ็บนะโอเค Patient very comfortable. I don't use 4.5 millimeter transducer in marginal mandibular and temporal area. I prefer multiple pass for lifting. But use stacking technique only in area need more tightening. Including submandibular area. 1, 2, 3. 1, 2, 3. To target submandibular area. Okay. Next, I will move the 3 millimeter transducer. On lateral face, anterior malar area, and temporal area. I use 900 pen shots per side. The pen applicator helps refine detail and improve comfort during treatment. We can safely use the 3 millimeter transducer in temporal area for patients with a round face. I use both grinding and circular stacking technique. The grinding for lifting, the circular stacking for target tightening. I will focus on retaining ligament to contouring, to improve contouring. Okay. Clean that area. Okay. Finally, I use cool face along lifting vectors, including the functional ligament line, the nasolabial fat toward lateral orbital area, and the jaw toward preauricular area. we apply the gel first. Okay. I will use 150 shots per side. Okay. I will focus on 3 lifting vectors, including the functional ligament line, the nasolabial fat toward lateral orbital area, and the jaw toward preauricular area. I use 50 shots per lifting vector and use levels 8. Okay, start. Okay, the first I will focus on the functional ligament line and use 50 shots per side. Does it turn? Okay. Patient may feel some heat, but no discomfort. I use 50% overlap with multiple parts for more tightening. DCC technology or cool-phase system provide real-time temperature indicator through color coding. The green indicate optimal treatment. Then I move to the nasolabial fat toward lateral orbital area to target dermis and fibrous septae and orbital retaining ligament, zygomatic ligament. If the area feels too hot, I move another area and come back later. Okay, finally, I focus the jaw toward preauricular area and use 50 shots per lifting vector. Okay, finish. Touch it. กิน
Now
ได้เล
you
ยครับ
finish?
Yes.
Okay. So can the patient, can you ask the patient to sit up so we can see the difference between treated site and non-treated site, please?
Okay. Right after treatment. Okay.
Wow, very beautiful result. You did great.
Okay. Okay. We can already see improved tightening. The jawline and facial contour looks more defined and improved tightening compared to untreated side. The collagen remodeling will continue over the next 1 to 3 months. Okay. Thank you for your attention.
Thank you
Okay,
so
finish.
much for your excellent presentation and for the result that is very good. Do you guys have any question from the floor to ask Dr. True about his technique? Okay. Dr. True, for you, how do you decide which patient is the ideal candidate for cool face alone or Liftera alone or with the Kutera protocol? How can you select the patient? Can you share us?
Okay. For this patient, is ideal to choose to treat Kutola. I choose patient the mild to moderate skin laxity with good facial volume. Uh, if you want lifting, you choose Liftera. But you want more skin tightening, you choose the cool face.
Okay. So I think for the reason why we use the lifting first in this case because we want more lifting effect, right? We want the HIFU to target directly on the smash level, and then we want the radio frequency to achieve like reduction of the volume and deep bulk heating. Okay, and are there any question on the floor? You can come for the mic,
Okay. Please feel free to ask.
please.
So after cool terror treatment, should we cool down the skin with the cooling mask or something like that? Or should we just keep the heat?
For me, actually, I think for both cool face and Liftera, normally I will not mask because I was trying to accumulate the heat to produce the neocollagenesis. But however, in some cases, like they don't need, they have no time, but they have to do other procedure next to the Kuthera program. Maybe we have to cool down around 20 minutes or 30 minutes or apply more numb cream for just a little bit to do like maybe filler injection or Botox or biostimulator. Yeah.
Thank you so much.
Me also, I think we need heat to be there. So please do not use any cooling device after doing this energy based. Okay. In some practice, they use the hot pack to make it more warm, because we want the heat. And as Dr. Saruta mentioned, if you need to do any other injection after this program, you can wait, just wait, but do not mask, do not use any cooling device, just wait about 20 to 30 minutes, then go on. You can do any other injection. Do you have any more questions? Feel free to ask. And another question for Dr. True. During the treatment, are there any endpoint that you focus on the patient? Uh, is that any specific concern like the pain scale, the erythema on the face, or something like that? Can you explain to the audience?
Okay. My primary endpoint is treatment adequate coverage along lifting vectors, including the smash, retaining ligament, and fiber safety. Okay. While maintain patient safety and comfort. Okay. That's enough.
Please.
How long the result can last after the combination treatment?
For how
How
long?
long- how
Yes,
long the
how long
result
it
can-
lasts.
Yeah.
Normally, I would tell my patients allow 4 to 6 months because we cannot guarantee that each neocollagenesis in each patient are very vary. Normally, we have to say around 4 to 6 months, and you can come and repeat the session. Yes,
Okay.
but however, the most visualized effectiveness after the session will be around a month and a half because it's a process for the neocollagenesis in our tissue.
Okay. One more question. In our country, some clients cannot afford the two treatment at the same time. So, if we want the same result, combination treatment, can we separate the treatment interval? I mean, the high full after 3 months, the cool phase. So, can we get the same result?
Um, Of course, but when we are we have to do the patient's education first. If I have like these patients, like a choppy face, yes, I will try Liftera 2 first. And then you mean that they want to wait for around a month or maybe 2 months and do coming back and doing the cool phase, right?
Yes.
Yes, and then after they come back again, we have to re-evaluate again that what happened, what the effectiveness of the Liftera 2, and then we continue the cool phase. Maybe we can adjust the shot or maybe the level of the power
Oh,
after that.
okay,
Yes.
okay. Thank you.
So between Liftla and Kufes, if we want to separate, if the patient want to separate, so for you, what's the interval between each treatment?
Normally, I will wait around a month and come back to do another device. Do Liftera 2 first, and then a month later, coming back and do the Q phase. But um, in some exceptional case, um, let me say after Liftera, the patient feel like they feel like a little bit pain and they want to do cool phase later. Maybe they can come back tomorrow or maybe next 2 days and come back for to doing the cool phase is okay because the main point that we want to do the skin lifting, contouring, and tightening at the Coursera program. Okay.
And Dr. Sarvata, can you share us if anyone here has not yet experienced with the Kultura program? Can you share any tip and trick for this program or this protocol?
Yeah, for me, if they're a first-time user of the Coursera program, when you the best thing to do the most effectiveness of the program is to select the patients. The patient that appropriate for the program should be the patients who have the mild to moderate laxity, not severe laxity. The second is you have to do the technical device to get to know the device first. When you're doing the procedure, the tip of the cartridge, not only Liftera 2 but also the cool face, must be continuously contact to the skin surface to avoid unfavorable side effects. Okay, and no need to trying to increase the energy or the level too high. You have to looking at the patient's skin surface and their sensations that to avoid the side effects first. Okay.
Are there any more questions from the floor? We don't have much time left. Okay, so before we close this session, I would like to sincerely thank you to our esteemed speaker, Dr. Charita Unjitichai and Dr. Chitrin or Dr. Tu, for sharing such valuable clinical knowledge and live demonstration. And today's symposium has shown us how cultural protocol can translate into real clinical practice for better patient satisfaction, longer lasting results very fast. As you can see, Dr. True used two devices in less than 20 minutes because I, ca- I look at the time. Okay, and I hope this symposium has something for you, and I wish you can continue using the Kutala, Kufes, and Liftala for your aesthetic practice. And thank you so much once again for your attention and participation. I hope you all enjoy the IMCAS Asia 2026 in another next 2 days. Thank you so much.
Thank you.
Thank you.